Good morning, good afternoon, and good evening to all across the globe. So just a tiny bit of history that Metadora was one of the first women physicians who wrote on the diseases and cures for women somewhere in the 1st century. So we know many women pathbreakers with outstanding contribution in science, Madame Curie, Virginia Apgar, and Rosalind Franklin, to name a few, which all of us would be familiar with. So although women are the backbone, constituting about 75% of the healthcare workforce across the globe, only 25% are senior leaders. As the world evolves, so does the role of women as leaders and inspirational forces. We need to recognize potential and talent and promote more women into leadership positions. So the Women Leaders in Pediatric Oncology Network was essentially aimed to promote female leadership in pediatric oncology and to build the next generation of talented female professionals in pediatric oncology. And we aim to do this through events, role modeling, and networking opportunities. On behalf of the Women Leaders in Pediatric Oncology, I welcome all of you to our flagship online event, where 3 trailblazers give us an insight of their journey. So just a little bit of the agenda. The translation in French and Spanish is available. If you all click on the globe at the bottom of your Zoom screen, you will be directed to whichever language you want. The questions are welcome. Please type them in the Q&A box, and the recording will soon be available on the Facebook channel. So the first person we have today, first speaker, is Dr. Lori Wiener, who's at the Center for Cancer Research at the National Cancer Institute in the United States. She is co-director of the Behavioral Health Core and head of the Psychosocial Support and Research Program. As both a clinician and behavioral scientist, Dr. Wiener has developed a robust clinical and research program that has focused on critical clinical issues such as parental coping, lone parenting, transnational parenting, sibling and sibling donor experiences, graft versus host disease, and end-of-life planning. Dr. Wiener led the team that has developed the first evidence-based psychosocial standards of care for children with cancer and their family members. She has published over 250 publications spanning peer-reviewed papers and book chapters, co-edit the textbooks of pediatric psycho-oncology. I can go on and on, but I'll stop here and hand over the mic to Dr. Wiener. Thank you so much for being with us.
Thank you so much for that beautiful introduction, and I'll try to share my screen.
I'll stop.
Okay. Can you see my screen?
Yes.
Okay, great.
Perfect.
All right. I am so truly honored to be part of this prestigious panel. And when thinking about the trajectory of the past 40 plus years, I really struggled with where to start. But for each of us, there's a story. My beginnings in oncology began in 1981 in a blistery Sunday morning in New York City when I was searching the New York Times employment section, not at all sure what I was looking for. I just knew that the work that I was doing at the time, outpatient mental health during the day and private practice at night, was missing something. And one ad for an opening at Memorial Sloan Kettering Cancer Center struck me as intriguing. I cut it out and put it in the maybe pile, but then I put it away. What was I thinking? I had no hospital or cancer experience. But the next day I found myself picking it up again, but again, I put the ad away. The third day, I said to myself, there must be a reason that I have not thrown this out. So I applied, and a week later, I went for the first of several interviews. At the end of the 4th interview, I was asked a pretty brilliant question. Tell me why you are really here. I remember being honest and said that I'm trying to figure this out myself, that I was looking for a way to use my clinical skills in a way that feels more meaningful. Her response? Thank you very much for taking the time to come in here today. I was sure I blew it. But several weeks later, I was offered the position, and I still wonder if I was their second, third, or fourth choice. I did not have an easy start. My learning curve was huge, first in terms of cancer terminology, but my biggest challenge was witnessing such extreme fear and grief and remarkable awe at their resilience. There were still two patients that remained vivid in my mind. Angelica, a beautiful and articulate 24-year-old woman with AML, and Vincent, a 19-year-old funny and engaging young gay man with rhabdomyosarcoma who underwent very disfiguring head and neck surgery. I observed their sense of disbelief at their diagnosis, their hopes and dreams and fears and anxieties that waxed and waned with the day-to-day medical events and treatments and biopsies and scans. The truth, I was not at all prepared for this work. I would listen, reflect, inquire, but overall, I felt useless. Their pain was so palpable. I eventually convinced myself that these people needed someone who could truly help them, not some 20-something-year-old with so little to offer. Perhaps worse, I was carrying their pain and frustration with me. I found myself constantly recalibrating my priorities. I pushed friends away. Their problems just seemed inconsequential. And I only found comfort in my passion, photography, spending increasing amounts of time witnessing life and searching for beauty from behind the scenes, but from behind the lens. And the accumulation of my angst, not surprisingly, was each of their deaths in less than a year. I stood by as Angelica bled out, an experience to this day I will never forget, or her parents' shriek of horror. I was with Vincent as he died, and this was the first time I witnessed agitation in the face of air hunger. Each of their deaths and the many subsequent deaths took a toll on me. It was my mother who gave me very wise advice. Give this 6 months, Lori. If it continues to destroy you and your spirit, this is not the right field for you. If, on the other hand, you could have an emotional energy for a life outside of work, then this work may bring you great meaning, but get professional help so you don't have to figure this out alone. I followed her advice. And slowly I learned to refocus my attention from my very lengthy laundry list of inadequacies to begin to realize that maybe I wasn't as useless as I imagined. And while I desperately wanted to run out of the room when the bleeding could not be stopped and breathing became labored or parents began to fight, I didn't. I remained present to witness what the family was experiencing, to listen, acknowledge the magnitude of the loss that was about to occur, and to model and encourage touch sometimes, despite my own fear. Fear actually turned out to be a great motivator. It was less than a year at Memorial, I was asked to help the chief of dermatology with the mental health needs of young gay men who were presenting to their department with rare opportunist infections, Kaposi sarcoma, and mental health challenges. This was the beginning of the AIDS epidemic, but we didn't realize that then. What a frightening time this was due to the stigma, fear, and so many losses. It was during this time that I had the opportunity to develop the first psychosocial support and research program for persons with what was then referred to as GRID, gay-related immune deficiency. If you read the book and the band plays on, you wouldn't know how many women were at the front lines caring for these patients. Believe me, they were. And it was during this time that I realized I really needed more training and began to pursue a PhD program at NYU. It was those years that prepared me for the next phase of my career. I had gotten married, my husband took a position in Baltimore, Maryland, and immediately after taking my comps, I began interviewing in the Maryland, DC area, and in January 1986, began to work at NIH to help fill PISO, to help incorporate pediatric HIV into the existing Pediatric Oncology program. I never expected to be what people affectionately called NIH lifers. And that first year was painful too. There were very few pediatric oncology staff who wanted to work with children and families with AIDS, and some staff left. But we persevered, and almost 600 patients later, the first treatments for children with AIDS were approved. And during this time, I was able to develop a robust research portfolio, studying really unique aspects of children and families living with AIDS, such as diagnosis disclosure, impact of public disclosure, affected siblings, fathering a child with AIDS, psychiatric manifestations and AIDS bereavement. But most important to me, I was able to capture the voices of the children through their art and words and complete my PhD. And with treatments now available in 2005, our program phased out. and I returned to the pediatric AYA oncology world. And here I was able to create a model that has continued through today and to work with an amazing team in the development of psychosocial standards of care.
I'm really sorry for interrupting, Dr. Wiener.
Yes.
Could you just go a little bit slower because they're being unable to translate?
Okay. So
Thank you. Thanks.
Once a New Yorker, always a New Yorker. What has this program looked like over the last 17 years? Well, first, to provide excellent psychosocial care in the form of clinical services to patients and families to enhance coping and adaptation. And it's what we learn from our patients and families that help us to be able to think about the research questions that are most important to ask, generally those that there really isn't any data on and that are novel. And then what we learn from our clinical services and our research, we then are able to take and to develop and implement and evaluate new resources that can then be distributed throughout the world. The most important part is the continual integration of clinically identified and research-generated projects. Let me show you some examples. But first, being able to look in the AIDS world, the lived experience for children and families with AIDS, textbooks, the psychosocial standards of care, and most recently, a special issue looking at psychosocial issues for children and adolescents living with rare diseases. But perhaps more important to me was being able to develop therapeutic and educational resources for children and for their parents and caregivers. These are all available for free on our website. Storybooks for children, an advanced care planning guide for adolescents and young adults, an electronic screening tool called Checking In, which is now available through the cancer support community, and therapeutic games, the most recent of which is the CAR T road trip to help children who are going to be undergoing CAR T therapy be prepared. So what are the lessons that I've learned through this process? Well, first, every family comes with a story, and I never stop being amazed by how important the sharing of stories can be to the relationships that we have with families. A wonderful grief counselor by the name of Dr. Alan Wolfert wrote, "A life without story is like a book without pages. Nice to see, but lacking in substance. Plus, there's healing in the telling, which is why I look to be able to create storybooks and workbooks." Not only can't we cure everyone, we can't fix or resolve all the issues that our families face. Some will find new doors to open, and others will not be able to find the peace we know they so desperately are searching for. But there are things we can do. Patients will always remember how you spoke to them, how you made them feel. Just your consistent presence is a true gift. Choose your mentors wisely, not just people who think the same way about problems that you do, but persons who will challenge you and introduce you to others to help you grow. And always remember your mentors and their birthdays. Recognize unhealthy or even toxic work relationships for what they are. I have found resolving even small grievances early is critically important. They will fester and can make your work life miserable. Is there something you need or want? It never hurts to ask. You will never know if you don't. As my colleague, Dr. Marilyn Powell would say, and be shovel ready, fully prepared with whatever your plans are in case you get the surprising yes. What is a comfortable work-life balance for one person may not be the same for you. Find what brings you joy. Ask yourself whether what you do each day when you wake up aligns with your values. Help those you are mentoring to do the same. Something that I have not mastered is that it is okay to say no so that you could say yes to yourself more often. So if the ask will impact the quality of your life, listen to that voice. And this work is emotionally challenging, especially when patients you care for deeply cannot be cured. Find a way to grieve each loss as they occur. Rituals help. Those cumulative losses will take a physical and emotional toll on the hardiest among us. But know the difference between being sad and being depressed. This work can be sad. Reach out for support if you're struggling. Stay connected with others in the field. SIOP is a fabulous organization. Persistent professional isolation leads to burnout, while professional connections can help us grow, stay current, learn new skills, and obtain much needed personal nurturance. I have found teamwork and collaborations to be a key antidote for burnout, and conferences may be a great time to get out and explore new places. Thank you, Dr. Kazak and Thompson, for that one. And finally, you may have a bucket list of places to visit and things to do in your personal life. Keep a bucket list of professional goals. I know one of mine has been to give a talk on most of the world continents. Unfortunately, COVID got in the way of that, South America and Asia, but I will still keep this on my bucket list. And we can't be able to do this work without amazing mentors and colleagues. And the first is Jimmy Holland for creating the field of psycho-oncology and providing me an opportunity to build a pediatric track through APOS. At NCI, none of my work would have been possible without Dr. Philip Pizzo. Philip believed in me and what I could accomplish way before I believed in myself. And there are just not enough words to describe his skills as an oncologist, leader, teacher, and soon-to-be spiritual guide. My wonderful branch chiefs that gave me carte blanche to study and create the programs that we thought could enhance the care provided at NIH. To my wonderful colleagues and friends, Dr. Wood, Weaver, Mitchell, Thompson, Powell, Wakefield, Kazak, there's so many more I could be able to put down here. And next to Anne is a little boy by the name of Maddie. Maddie and his wonderful parents, Vicki and Peter Brown, is what really inspired and led the standards of care. And a very special acknowledgement to my family. My parents had taught me from a very young age the values of helping others. My husband, who has stood by and patiently accepted my crazy work hours, and my own children for being secure in the intensity of my love while sharing me with so many other children in need. And of course, our fabulous four-legged rescue besties. Not pictured here, as all of us could say, is those patients and families who have shared their deepest hopes and dreams with me and have allowed me to be their voice in sharing them with others. They will forever be my teachers. So I very quickly went through over 4 decades. The last question is the future. That story is yet to be told. Thank you.
Thank you so much, Dr. Wiener. That was absolutely wonderful to know, I think for anybody to know how they go through, their whole life when you're a, enthusiastic student, and then to manage to keep your enthusiasm going for the next 40 years. I think I'll hand over to Faith for the Q&A, or do we want them at the end?
I think we're going to do Q&A at the end, Amita. So I think we're going to go
Perfect.
speakers and then Q&A at the end. I think that will work brilliantly.
Right.
Yeah.
Okay. So now it's an absolute pleasure to have Rachel Hollis on board with us. And whenever I've met her a few times at SIOP meetings, I've always felt, so good meeting her because she's so inspirational. So she's an honorary nurse advisor at the Leeds teaching hospitals in pediatric oncology in the United Kingdom, and has spent more than 30 years working in pediatric hematology and oncology in Leeds itself, and has been involved in developing services for children and young people with cancer in the United Kingdom and the local and the national level. She's been a long-standing nurse member of SIOP, having served on the nursing committee and author of the SIOP baseline standards for pediatric oncology nursing care. And in addition, she has been engaged with the Global Healthcare Network, which is now becoming really important, especially for promoting nursing care in the low and middle income countries. She works alongside nurse members of SIOP and the international colleagues especially to integrate nursing into the WHO Global Initiative for Childhood Cancer. Rachel was made fellow of the United Kingdom Royal College of Nursing in recognition of her work, and chairs the Professional Nursing Committee of the Royal College of Nursing. So over to you, Rachel. Thank you so much for being with us.
Thank you very much, Amita, and thank you for that nice introduction. I'm hoping that I'm now sharing my screen, and could you just confirm that for me?
Yes, yep. It's absolutely fine.
Looks great.
Great, thank you very much. So as Anita says, I'm a nurse. I work in the United Kingdom, and I live in the beautiful county of North Yorkshire, where it's very cold, being winter today. So greetings to everybody from the UK and from Yorkshire. Like Laurie, I'm going to talk first about my nursing journey, similar length of time, I think. So for 4 decades working in nursing. And when I sort of mapped it out, it looks fairly well ordered and quite planned, going through from being a student to a staff nurse in paediatric oncology, to a ward sister, to a lead nurse for children's cancer. But actually it wasn't planned like that at all. So I started my nurse training back in 1982. I trained as an adult nurse. I had no particular interest in paediatrics. In fact, the paediatric placement was the one that I was probably looking forward to the least when I did my training. But I got to the children's ward at St Mary's Hospital in London, where I did my training, and felt that actually children's nursing was probably where I wanted to be. So I continued for a short time in adults before then going on to train as a children's nurse. Not quite sure where that would take me. During that training, then I had a placement on the Pediatric Oncology ward. Again, it wasn't a placement I was particularly looking forward to. I thought the work would be difficult. But when I walked on the ward, I realized that that was where I wanted to be. Like Laurie, I have very clear memories of some of the first children that I looked after, and not just the children, but their families. And what I valued very much was getting to know the families, and this was a field of nursing that I decided to stay in, and went back to work first as a staff nurse on the Pediatric Oncology ward in Leeds, and then became a ward sister on the same ward. That period as a ward sister is in many ways some of the most one of the most rewarding roles that I had during my career, where you know every day what a difference you're making, not just to children, young people and their families, but to the team that you have around you. And I think it's a role that is often perhaps not valued as much as it should be, but it's a really valuable role in making sure that services run safely and that children are well cared for. So that was a role that I enjoyed and stayed in, as you can see, for more than 20 years. And then, but what I also realized, and this is something that I will come back to as I talk, that sometimes you need to be able to be at a different level in order to influence change and to make a difference. And so I moved a little bit away from the bedside to become the lead nurse for children's cancer in Leeds. So during the time that took me from my time as a student nurse to my time as a lead nurse for children's cancer, then always underpinning that was my own personal and professional development. So that very much followed the roles that I took, rather than again being planned. So that having trained first as an adult nurse and then as a children's nurse, I then, when I realized that paediatric oncology was the place that I was going to stay, then I undertook specialized training here in the UK. And as I developed in my role from that of a ward sister to a lead nurse, I recognized a need for greater underpinning of my practice, and undertook at that stage a master's degree. Now, Amita introduced me as an honorary nurse advisor in children's cancer. That's because I have now retired from my clinical practice, but I remain a registered nurse. I remain active in paediatric oncology. And so when I think about my development, actually retirement has been an important part of my professional development, learning, taking new opportunities and new skills. So carries on underneath. And although I think I'm sharing some of what I've learned with those who are at towards the beginning of their careers, I think there's also some things I might want to say to some of those of my peers who are maybe beginning to think about what the future holds in terms of as their career moves on. So that gives you an overview of my professional career up until where we are now. And I just want to reflect on some of the things that I've learned along the way. And actually, really, Laurie's points about stories really resonated with me, because I think one of the most important things that I've learned is about the importance of listening, and in particular to hearing children and families telling their stories. You can hear so much. You can hear so much about what brought them there, and you can learn about how, as a nurse, as a healthcare professional, any healthcare professional, how we can really make a difference to the experience that they come with. So I think listening to children and families, listening to them telling their stories is probably the greatest lesson of my professional life. But equally, listening to members of your team. So I think that while caring for children and young people has been one of the great joys of my professional life, so has been building, sustaining and developing the teams that I've worked with. And listening is important there, to understand what matters to individuals, and to understand what makes people work, what makes you able to support them to give of their very best in the workplace. But the other people that you sometimes need to listen to are those who you want to influence in whatever sphere you work in. Again, you need to understand what it is that they're looking for, and to think about how what you do can contribute to their own agenda, so that you can make the change that you want to see. So listening is critical. But I think also one of the things I've learned is to take the opportunities that come along, because you really don't know where they'll lead you, and you don't know the skills that they will give you. And those skills can then help you as you develop to look for more opportunities. And then looking back, you can see where some of this was taking you, but even at the time, you don't realize that's really where you were going. I think for almost anyone in the healthcare workforce, and in fact for people, we want to make a difference. You hear that so often when I interview people for a job. Why do you want this job? It's because I want to make a difference. And so it's finding the ways that you can make a difference in the work that you do is really important. Mentorship is important. Laurie has talked about that. I know that others will do so. But I think for me, the most important thing has been the professional friendships of peers, and finding the people who become your people. So at the top of my screen, you will see some of the women that I trained with as a nurse some 40 years ago, and had the great pleasure of celebrating the wedding of one of them just a couple of weeks ago. So those are people who have always been there through my professional career. And the other people who've been really important to me have been my Pediatric Oncology nursing peers here in the United Kingdom. And people will, I'm sure, be recognising Professor Faith Gibson in the middle of the bottom screen. And this is a group of, again, women who we've worked together on the national level since the 80s in looking at how we can make a difference to children's cancer care and nursing care in the UK. One of the other things that I've learnt along the way, and this is directed perhaps a bit more to nurses who may be listening today, is that I hope I have never said that I'm just a nurse, because that's something that I hear all too often from nurses. And nursing in the UK, at least, is a majority female profession. Amita talked earlier about the percentage of the global health workforce that is female. Now, of course, more than 50% of the global health workforce are nurses. And in the UK, 90% of nurses are women. And I'm very aware that's different in a number of different countries. And nursing has too often been seen as unskilled as women's work and can sometimes be undervalued. But we see leadership in nursing everywhere. It's often invisible. And it's really important that we're able as nurses to articulate what it is that nurses do and to value the profession and the contribution that we make. And I'd just like to highlight to those who are nurses, but also to others, two really important writers and thinkers in this regard. So Suzanne Gordon and her books From Silence to Voice, and Jennifer Jackson, who's recently done a lot of work on articulating what it is that nurses do and contribute not only to patient care, but to healthcare systems. So one of the things is never to say, I am just a nurse. And then finding the places where you can make a difference. And I think for wherever we are in the healthcare professions, it's in the local setting where we begin to develop our skills. We establish the building blocks of our career. And for many people, that may take them to different organizations. For me, I stayed within the same organization in Leeds, but then reached out to look at where I could make a difference at the national level. And for me, that was through our Royal College of Nursing. And I think very important to contribute to and be involved in the work of a professional body, whichever profession you come from. And our Children's Cancer and Leukemia Group, again, thinking at that national level about how we can develop services further for children and young people. Amita has mentioned my involvement with SIOP. Laurie mentioned SIOP as well, such a critical organisation for making a difference to children's cancer care on the international level. And certainly that, for me, has been some of the most rewarding work that I've done, and particularly in these later stages of my career when my focus shifted more to the international arena, where again I've made such strong professional friendships which sustain the work that we are all able to do. But I think it's also important for us as healthcare professionals to think about how we contribute to civic society. And for some, that's through politics. For others, that's through faith organisations. For me, it's been through the work of charitable organisations. So here in the UK, our national children's charity, Young Lives Against Cancer, and then World Cancer UK, which I'm sure many on the call will know about, and where I've been able to take the knowledge and skills developed through my career to this point to a wider stage. And I think that's where I'm sort of directing some of my thoughts to those who are coming towards perhaps those later stages of the career, to think about how we can continue to make a contribution, to make a difference, because it's by making a difference that we also can gain what I think can be one of the most rewarding things, which is the recognition of our peers. And I think for me, one of my proudest moments was being awarded the SIOP Nursing Lifetime Achievement Award. But just recently, I was awarded the fellowship of the Queen's Nursing Institute, an institute of nursing in the UK, and was very privileged to receive that alongside Elizabeth Iro from the WHO and Howard Catton, who's the chief executive of the International Council of Nurses. And when I think back to where I started some 40 years ago, it's that importance of taking opportunities, recognizing the value that you can make, and taking that forward into a career. So thank you. And I'm sorry, I think I've gone a little over my time, so my apologies for that.
So that thing looks very lovely. And thank you so much, Rachel. That was wonderful. And, you know, people like you, you don't retire. It's like you get retired, you know. So it's, and I think most of us, when we've been growing up, have been taught that a nurse is like Florence Nightingale, and, you know, they should be respected totally all lifelong. And I think we'll go on to our next speaker, who is Dr. Naureen Mushtaq from Pakistan. So she is an associate professor and pediatric neuro-oncologist. And as her slide says, she's from Pakistan. She's a section head of the Pediatric Oncology at the Aga Khan University at Karachi. And she has established pediatric neuro-oncology services at their hospital with the help of an excellent twinning initiative with the Hospital of Sick Children in Toronto. She has developed national pediatric brain tumor boards across Pakistan with the help of the My Child Matters grant from Sanofi Aventis for capacity building in pediatric neuro-oncology services. So she leads the pediatric oncology team and has developed the national guidelines for treatment in Pakistan for the treatment of the most common brain tumors. So thank you for being with us today, Naureen, and over to you.
We can't hear you, Naureen. Can you turn on the mic?
Yeah, can you hear me now?
Yes, it's perfect. Thank you.
Thank you. So thank you so much. And hello, everybody. And thank you so much for joining today. And thank you, Faith and Tessie, for inviting me to give a talk in this auspicious event of SIOP Women Leaders in Pediatric Oncology Network. So as Amita has already told you that I am from Pakistan. So I born in Karachi, Pakistan, and you all know that Pakistan is the 5th most populous country of the world, and it's being known for its poverty, terrorism, and corruptions. But one thing you don't know, that is Pakistan is a landscape of beautiful mountains, rivers, valleys, and it could be a great destination for your next journey. So I welcome you all to come and see Pakistan. It's really beautiful. So I'm the eldest and the only daughter of my parents. I'm married for the last 16 years and I have 2 sons, and my husband is the greatest support I have in my life. So in education, so I graduated from St. Medical College from Karachi. And then I started my internship from Aga University Hospital, which is still the place where I'm working as an associate professor for the last 20 years. So after my internship, my intention was to do child psychiatry. But the man in this picture, Dr. Abdul Ghaffar Billo, who is the father of pediatric in Pakistan, and he's the inspiration behind my decision changing that I have to take pediatrics because my personality suits pediatrics medicine rather than child psychiatry. So during my residency, I have decided that I have to take pediatric oncology, and this is all because of Zehra Fadoo, the beautiful woman in the picture, and she is the program director at the time, and still my boss because she is the chair of Department of Oncology at Aga University Hospital. So the day I finished my residency, pediatric residency, the next day I joined pediatric heme program, and at the time I just got married and got pregnant very soon. So it was like a very difficult time for me and for Zehra, who basically the supporting system for me, and she's always there to help me out. And it's because of her all help and support that I have been able to complete my pediatric oncology fellowship program in 3 years. So in 2009, I completed my fellowship of pediatric oncology at AKU. And then after 5 months, I joined again as the faculty in the Department of Pediatrics as a pediatric oncologist in 2010. So from at the time, I have seen really, challenges for the treatment of pediatric brain tumors. And, although we have the basic infrastructures at AKU, with good excellent neurosurgeons, good neuroradiology program, we have pathologists, we have a radiation oncologist, but we don't have a dedicated pediatric neuro-oncology team. So this is the same story across Pakistan. So pediatric neuro-oncology is one of the most neglected field. And when I talk with my seniors and people who are doing pediatric oncology for the last 10 years, they were thinking, we are still fighting on treating children with leukemia, lymphoma, retino, and WIMS. So really, it is really difficult that we develop something, an MDT or maybe tumor boards or capacity building of neuro-oncology with the neurosurgeons in Pakistan. So it's a big no. It's really difficult. You can try, but I don't think that you will be able to do that. So but fortunately, I got the Faculty Development Award awarded by the University in 2013. And then I've decided to take my specialty training of pediatric neuro-oncology from sick kids. And there, as someone has really said, that choose your mentors, but actually I was not, I did not choose my mentor, but I actually blessed with one of the best mentor. So find a great mentor who believes in you and your life will change forever. And my mentor is Dr. Buffet. So he's the man who basically, when I went there and he asked me, Naureen, what do you want to do when you go back to Pakistan? So I told him, I cannot do whatever you are doing, like such highly specialized treatment and targeted therapy and clinical trial. But what I can do is that I can improve the quality of life of my children. And maybe I'll develop a pediatric neuro-oncology dedicated team first at AKU and maybe after some time in Pakistan. So he said, okay, let's start something. So we have started this twinning initiative back in 2014 when I came back to Pakistan. And since then, it's been running successfully every month. So it was started with the help of monthly tumor board, which was Zoom linked. And it's not only with AKU, but we have joined hands with other colleagues in Karachi, and one of my friend and colleague from Indus Hospital, Dr. Syed Amar Hamid, he's the one who basically joined hand with me, and he's always there to support children of brain tumor at his center, and he's the one who basically helped to develop pediatric neuro-oncology in Karachi. So in this program, we basically invited neurosurgeons, pediatric oncologists across Karachi, radiologists, radiation oncologists, and pathologists. And we discussed patients from 3 to 4 centers of Karachi. And then, with the help of this initiative, we have developed management guidelines of our patient. We have more referrals. We have basically so our patients have better quality of life. So after this, it's not only that we have started this tumor boards program, but we have also started having targeted therapy in Pakistan as compassionate access through our compassionate access program. We have sent samples to sick kids where many of our patients got a proper and appropriate diagnosis, and treatment was provided accordingly. So this whole program helped us immensely. So after this, we have established a pediatric neuro-oncology dedicated team first at our Khan Hospital. Then Dr. Amar started a dedicated neuro-oncology team at Indus Hospital, and we also we helped other centers to develop their pediatric neuro-oncology services in Karachi. But we just recently published one of the paper in Pediatric Blood and Cancer about our 7-year-long training program initiative. It's about building the ecosystem of pediatric neuro-oncology care in Pakistan. So then we were fortunate enough to got this grant in 2019. So the capacity building we have started first at AKU. We then intend to develop this capacity building across other centers of Pakistan. So this is by Child Matter Grant, by Child Matter Grant, and by Sanofi. And it's not only myself that I have started this, but I've started with 5 of my colleagues. So if you see this man is one of the best pediatric radiation oncologists. Is Dr. Bilal Mazhar Qureshi. He is part of our team, my nurse Anam, who is really great in helping our patients all along. Dr. Shahzadi Resham, who is the first pediatric palliative care physician in Pakistan. Dr. Salman Kirmani, who is a pediatric chair, and he's a geneticist and endocrinologist. Dr. Khurram Minas is the pathologist who helped us all along to develop our initiative first at AKU. And then he's the one who helped me all along to develop capacity building across Pakistan. And Dr. Gohar Javed, who is the best neurosurgeon of Pakistan. So with the help of my team, we have established a network of tumor boards. So we are doing 4 tumor boards per month. And from 2019 till now, we had around 108 sessions of tumor boards and discussed more than 480 cases, 400 cases till now. So this whole program helped us a lot and helped our colleagues in 13 different public or private sector hospitals in Pakistan. So it's not only that they developed their own multidisciplinary teams, but they also developed treatment guidelines. They are also discussing their patients among themselves. And all this process helped developing these pediatric neuro-oncology services in many centers across Pakistan. So we have also have had 2 or 3 workshops before COVID, and 2 more, and it was attended by more than 200 participants. And with the help of all these capacity building services, we were fortunate enough to organize our first National Pediatric Neuro-Oncology Symposium in 2020, which was all virtual, and it was attended by more than 1,100 participants across 58 countries. Then we had our second Pediatric Neuro-Oncology Symposium last year, which was attended by more than 1,100 participants. Again, it was a hybrid session, and these are the participants of the symposium. So we have also organized more than 40 lectures, pediatric neuro-oncology lecture series since 2020, and it was attended not only by participants from Pakistan, but across the world, and about participants from 48 countries. So this capacity building also helped us to develop national guidelines. So we have developed Pakistan National Guidelines for the Diagnosis of Low-Grade Glioma, endorsed by the Pakistan Society of Pediatric Oncology and Pakistan Society of Neuro-Oncology. We have also established guidelines for the management of medulloblastoma and guidelines for the management of pediatric high-grade gliomas. So although this whole activity helped centers a lot, and so they are improving and treating their patients well, but there are many patients who are unable to go to those centers. So to improve the delay diagnosis and to improve the accessibility of the patient to the hospitals, we developed this first portal by the name of Children Brain Tumor Initiative Pakistan. And if you click that portal, you can so anyone who has a child with brain tumor, any parents, caregivers, any doctor, they can register the child with brain tumor here. And when they click here, this form is open. And in this form, you can just put the information, the basic information. It's both in Urdu and English. Click the symptoms and upload the picture of the scan or any histopathology. So once it's uploaded, so they will have this thank you message. And after the thank you message, what we will do, we will call them every Friday, 4 to 5 p.m., and we will develop the treatment. We will tell them the treatment management guidelines and how they will be able to manage their patients. So if a patient is residing in a small village or in a town, so we will collaborate them with the near center, the collaborating center of our program. So they will take their child to that center, and the treatment will be started and they have a better outcome. So this whole activity is not possible without the help of my senior colleagues, Dr. Shamil Ashraf, who has started Pediatric Oncology in Pakistan, Dr. Asim Riwami, who is the president of Pakistan Society of Pediatric Oncology, my dear neurosurgeon, Dr. Athar Inam, who is the president of Pakistan Society of Neuro-Oncology, and many of my colleagues, neurosurgeons, radiation oncologists, my friends, and doctors across Pakistan in those 13 centers who helped to make this initiative successful and who are treating and work tirelessly to improve the outcome of children in their own centers. So not to forget to mention my patients and their families and my two lovely fellows. So as part of this pediatric neuro-oncology initiative, we have also started pediatric neuro-oncology fellowship at Al University Hospital. And earlier next year, we will have 3 pediatric neuro-oncologists in Pakistan. So I finished my presentation on this picture. So my boys are big now. So, and so all this initiative cannot be possible with the help of my friends, the support system, my family, my parents, and of course, my mentor, who is always there to help me out and without whom I may not be here and telling you my story. So the lessons I have learned during all this journey is that everything is possible. So if I can do it, anyone can do it. Just if there's difficulties in life, just take a deep breath, step back, and then move forward. So your family, friends, music, traveling, and nature are the healing objects in your life. So thank you for patience listening. Thank you, everybody.
Thank you so much, Naureen, for that wonderful, inspirational thing that, So it's like the Nike advertisement, which says, just do it. So I think that's the message which, everybody can get, that you can just do it. And we've come to the end of absolutely amazing talks by 3 wonderful women. And I think I'll hand over the mic to Faith now to carry on with the question and answer session.
Thank you, Amita, and thank you so much, everybody. Yeah, absolutely. Fabulous leaders in their field. I'm just going to share my screen, and I have to remember to speak not so fast. My job, just to bring us to a close, really, is to help with some of the questions we've had in the Q&A. And I would encourage you, please just add into the Q&A. We may not get through all of those questions in the time we have, but we can certainly go back to you with some responses. And you can write your questions in French or in Spanish, remember, because they will be translated. We are due to finish at 2 o'clock, but if we go just over that, then that is absolutely fine. There are some questions already in the Q&A, so I'm going to start there. Obviously, some fabulous comments about how great it was to listen to people. And then I've got a question from Brigitte Müller. And this is to Laurie. Have you ever received pushback for being a woman?
That's a great question. And hey, Brigitte, the first half of my career at NIH, the branch chiefs were men. I never applied for that kind of leadership position, which most of the leadership positions were men at the time. So I've been very fortunate that really women have been provided with opportunities to be able to grow and to do the work that they want to be able to do. But I think as you move up the ladder and into some of those directorship positions, it's still pretty heavily men. I would hope that this has really been changing. but I've been fortunate for myself for the kind of work that I'm doing, that it hasn't been a challenge.
Thank you. And I guess I'm just going to follow that on with a question from Courtney. Courtney Sullivan, who is a nurse. And it's a great question. And obviously it's saying great trailblazers we've listened to. And this is really, anybody could have a stab at this. But Rachel, I'm going to start with you. What are some of the key ingredients, words of wisdom you could share with us that kept you going along the way? That's a nice question.
It is a nice question. Thank you. Thank you, Courtney. And I think it was a couple, in terms of what's kept me going along the way, I think it's some of the things that I highlighted actually in my talk, which is those professional friends that and supporters and mentors who you can go to and talk through anything. But I think probably the most important thing is about making a difference, finding a way to make a contribution, whatever that is. And sometimes that's very immediate. So when you're at the bedside, that is, can be generally very immediate, but sometimes it takes a long time. And I think sometimes for me, it's looking back at a change that may have taken 5-10 years to come to fruition, and recognizing that, something that you have done has made a change, has had an impact, has made a difference, even though it might take a long time to recognize that. And I guess that's the benefit of being able to look back over the lifetime of a career.
Thank you, Rachel. Naureen, would you add anything to that? What would be what's kept you going, other than the lovely pictures you showed us of the outdoor, your family, all those great things? What else would you add?
So for all my dear colleagues, so life is all there for you. So there are struggles and very difficult phases in your life, and there are phases in which I used to say, okay, I just leave everything, I just don't want to carry on. But as I said, take a deep breath. So your family, your friends, and your patients are there to help you out, and your achievements, which keeps you going. So everything, anything can be possible, and anyone can do that. That's my advice for everyone.
Thank you. Thank you. Laurie, would you add anything before? We've now got lots of questions coming in, but Laurie, what would you add on to that one?
I think you've heard some wonderful suggestions. I think we get really caught up in what we're doing and we end up in a silo. So if you're just doing clinical work or you're just doing research, to expand and to do something a little bit different. And I think that helps you to grow. It helps you to recognize the importance of what you're doing. It helps you to be better at what you're doing. But expand outside of your silo and try something different. And it may be just connecting with a colleague who's doing a project that you may want to be involved with, and to be able to learn from them. But there is always learning to be done. Getting too comfortable in one place, it will stop people from being able to expand and to be able to grow in their respective fields.
Thank you. Laurie, I'm going to sneak in one of my own questions to you before I go on to the highlights here. But everybody spoke about mentors, but just how do you choose a mentor? I'm not sure we are ever really clear on how do we go about that? Everybody spoke about them, but how do we choose?
Well, sometimes it happens by happenstance, and where you're working. But if you are interested in a certain area, and you know that there is a leader in that area, I just say reach out to them, and to be able to let them know who you are, and to see if they were willing to be able to give you a little bit of time to be able to talk about your career trajectory, things you want to learn, if they have projects you can participate in. I found that people are really open. They may not have any time, but when it comes to junior faculty or people who are relatively new in the field, people want to share their lessons. And if they can, be able to help you, I have found that they will refer you to somebody else who can. But it's taking that first step and reaching out to someone who is involved in an area that you would like to be able to learn more about.
I like that idea of taking the first step. I think that's a really important thing.
I get emails all the time from people, you know, in different areas, or dyadic coping, or just something that they've seen that I've published, and it's welcoming.
Great, thank you, Laurie. And then Kathy Pritchard-Jones, many of you I know will know Kathy, who's our past president of SIOP, and she's asked a question, which I'm going to ask of each of you. Naureen, I'd start with you. So what's the most important advice you'd give to a female healthcare professional wishing to develop their leadership skills? And you'll each have a chance to answer this. Naureen, what's the most important thing advice you'd give to one of your female colleagues?
It's actually hard work, persistence, hard work, and patience. I think anything can be achievable. So, but when you lose your patience, when things are not going right, so that's the thing that can cause hurdles. So just continue your hard work with patience and perseverance, and you will achieve your goal.
Rachel, anything you'd add? What would you give to a female healthcare professional, nurse or doctor? Yeah.
So I think just building on what Naureen has said is about that, when things don't go right, and I think being prepared to fail, being prepared to get things wrong sometimes, and then to learn from those, to learn from our failures. I think now, I think one of the things that I don't think any of us have mentioned really, but there is formal leadership training, and for some people that can be really helpful. And I've certainly experienced formal leadership training, looked for that, or found it in other places. And I think that for someone who is feeling lacking in confidence, then sometimes going out and finding something formal is helpful. But otherwise, I think some of the other things we've talked about, mentorship, support of friendship, then mentorship can also help you. If leadership is the thing you want to build, then look for a leader, and that could be someone that, as Laurie has talked about, reaching out to a mentor, then to reach out to that person.
Thank you, Rachel. Laurie, what would your advice be?
I think you've heard wonderful advice. I have learned so much more from the things that didn't go well than the things that did go well, but you have to listen to that voice and learn from that. If there's a leadership position you're interested in, learn about what the requirements are, people that have succeeded in that position and those who have not. Find out what you're missing. Let people know that you're interested in that. Again, mentors could be able to help you. And, if there's certain training that you need, or there are certain steps that you need to take care of along the way to get that position, then that will help you get to that goal. But always take time for yourself, and don't get so caught up in the leadership that you lose track of what you're doing right now. I think that sometimes happens. And if you don't take time for your own wellness, you'll be forced to take time for your own illness at some point in time. And unfortunately, I have seen that as well.
Thank you, Laurie. Now, I'm mindful I can see the number of participants, and I can see we're dropping slightly. So I think we should be thinking of wrapping it up, although it's been absolutely fabulous. And one of the things I wanted to say is, doesn't matter where you are in your career, I still learn things all of the time. So I've learned a huge amount, and I've certainly got quotes from each of you written down that will take me through the rest of my career, certainly. And there are some questions here that are very specific to people, which are not necessarily about being a female leader in the field. So I'm going to leave some of those and end by saying thank you so much, everybody. I hope we can continue to do these. It's always thinking, will they work? Will they not work? But actually, I think people are enjoying them and taking something away from them. And of course, there will be recordings. Let me go into the next slide. Whoops, where are you? Oh, there you are. You moved on. Thank you. We will have more of these events that I hope you'll be able to join us. We'll have one in April that will be online. We're planning to have another one in May. And we are going to try and link them into some of our SIOP meetings. This is the plan going forward. And we'll have one in 2023 at our Congress, which is in Ottawa and Canada. So these will continue. And certainly if you want to give us any feedback on how it's been for you as a participant or somebody who has been listening, then please let us know. We really want to be responsive to give people what they want from these groups. And if you want to nominate a woman leader from any professional group, please email us, and we want to keep this variety going, because I think, again, as you can see, you learn from different people who've been in different posts, which is great. And I think I have one more slide, which is obviously to say thank you. Merci beaucoup. Muchas gracias. And that's my best in terms of language that I can sum it up. But please, if you or anybody who's joined us today, if you're not a SIOP member, please do consider joining us. Do, of course, follow us on social media, and we want to hear from you. And I just want to end by saying thank you so much. And to Katie, who's been busy drawing some of the things that we've been saying, all of that will be shared too. So you'll be able to see illustrations from our talks today. And I'm just going to check if there's anything that I've forgotten from Tessie.
Faith, can you stop sharing your screen so we can see the drawing?
Yeah, I can. Can I bring the drawing up bigger? Brilliant. Thank you, Katie. Thank you.
Thank you very much, Katie. Looks amazing. Thank you very much.
Always good. Thank you, Katie. That's great. Tessie, anything else we need to say to close this? Obviously, thank you to everybody who's been part of this in terms of the organisation, behind the scenes, front scene, and of course to our interpreters. Tessie, anything?
No, thank you very much to our audience and to all the questions that we heard, and also to our translators and our amazing speakers. We really appreciate it.
Thank you, everybody, and enjoy the rest of your day, however short or long it may be, in whatever country you are in. So thank you so much, everybody. Bye.
Bye.
Thank you. Bye-bye.
Thank you.
Good night.
Bye.